Welcome to Veterans of the North, a podcast powered by the DAV of Minnesota, where we talk with veterans, advocates, and change makers about service, sacrifice, and solutions. I'm your host, Trent Dilks, Legislative Director of the DAV Minnesota and a veteran of the U.S. Army. Today's episode centers on the most urgent issue facing our community, veteran suicide prevention. Every day, we lose veterans to suicide, often after they've already reached out for help. We owe it to them to do more. That's why we're here on site at the Magnus Veterans Wellness Campus in Dayton, Minnesota, exploring how whole person care can change lives. I'm joined by Dr. Sean Alderman, founder, president, and medical director of the Magnus Veterans Foundation, a fellow veteran and physician paving the way forward in veteran care. Let's get into it. Sean, thanks for joining me.
Hey, Trent, great to be here.
Yeah, they make me read those things, and it's the one part of this I hate. I think they know that and still force me to do it. But thanks for having us out here. It's a beautiful campus. We had a chance to talk beforehand, and I'd love for you to share for both of our listeners a little bit about how this came to be, a little bit about your origin story.
Yeah. I guess we'd have to kind of go back to the beginning. You know, I spent 31 years in the Army, first as an airborne infantryman, and then went to Special Forces Assessment and Selection, and they made me a medic on the team. And I fell in love with medicine from that point, and ultimately went on to go to medical school and became an officer in the Army. And that was around the same time as 9/11. Okay. And that's when I made the decision that I wanted to go back to Special Forces because I knew my brothers were going to be in harm's way, and I wanted to go support them. So I spent about the next 20 years of my career taking care of primarily Special Forces soldiers and their families. And, you know, towards the middle of that 2-decade-long war, we realized that we were breaking soldiers, right? I mean, we were engaged in that war for a very long time, not just physically, but also mentally. And the Special Operations Command recognized that they had to do something different in order to meet these soldiers and their families where they were at that space and time in order to optimize their performance and keep them in the fight for the long term. And the Special Operations Command implemented something called the Preservation of the Force and Family. Excuse me. And that was essentially a comprehensive approach to taking care of both the soldier and the family, mind, body, heart, and spirit. And my last job before retiring in 2019, I was the group surgeon for 5th Special Forces Group, where I started as a medic. So coming full circle was awesome. And it was my job to implement that preservation of the force and family initiative. And I basically was given the troops, got troops to task there. So I had fellow doctors, nurses, physical therapists, psychologists, strength coaches, athletic trainers, you name it.
Yeah.
All the experts devoted to taking care of the mind, body, heart, and spirit assigned underneath me. And we saw it work. We took guys with horrible PTSD and we made them well again. We had families that were literally on the verge of imploding come back together again. And they're strong to this day. I keep in touch with these guys even now. And the bottom line is I saw it work. Yeah. And I knew I wanted to do something related to what we were doing with that initiative after leaving service in 2019. And that's where the whole concept, that's where what the whole premise of the Magnus Veterans Foundation is based on, that vetted and validated program.
So as this model's rolling out, I think of various Army and DOD initiatives that are immediately just kind of dismissed by soldiers, right? Just a very tough group. I've seen a lot of garbage models come through. How do you get the buy-in? How do you get that initial skepticism? This isn't some other BS thing that DOD is, trying to implement. How do you get that initial buy-in over that skepticism? This is something different.
Yeah, that is a fantastic question, Trent. And really, that's why I go back to the sort of the beginning, enlisting in '88, and then becoming a Special Forces operator. When I went back as a group surgeon, I knew all the guys I had served with were now command sergeants major. And they were very respected leaders within that group. And at that point, that group had been involved in the global war on terrorism for 10, 12 years plus. And so the first thing was to get the buy-in of my fellow brothers in arms that I had served with. And they came in and they saw what I was doing because they trusted me because I had taken care of them in the past. And they saw how it would work. And then they went out and they basically led by example.
Yeah.
And they went out to their junior soldiers. And when you see that sergeant major, that command sergeant major who you really look up to, come to you and say, hey guys, it's just as important to get a mental health check as it is a physical health check. Get in there, see Doc Alderman, and let's get this done right. And that really, it was that background and having that buy-in, that rapport that developed years before that was able to implement this.
Do you, as you transition out and you start to implement, and I want to hear a little bit about how you got here, this beautiful space we've been able to see, but do you experience that again as, new veterans walk in, people who aren't familiar with you or this model, who didn't come from the Special Forces sect in that area? Do you see that, and how do you overcome that again?
Yeah, pretty much in the same way. So, when I meet a veteran, my rapport development with that veteran is accelerated because we have a shared background, right? And in many cases, we've deployed to the same countries or served at the same time. But it's not just me. Every other person that works here, either on staff or as a contractor, is either a veteran, a family member of a veteran, or they have extensive experience taking care of veterans. And you can feel that difference. Any veteran who comes here will sense that and immediately, accelerate that connection. And that's so important because, when we meet somebody, there's a period of time where you're developing that rapport, you're developing that respect that ultimately leads to a treatment plan.
Yep.
And if that process takes too long, we may be wasting critical time that may impact that person's outcome, whether that's physically or mentally. So being able to speed that up and get that person on the path to success is incredibly important.
And that shared experience, that we see that in programs through the DAV, we see that all over, where that shared experience almost immediately creates a different level of intimacy as far as the relationships and things like that, the things people are willing to talk about. It really does. Fast forwards it, I guess, is how I would compare it.
Right. Yeah, absolutely.
All right. So we're here. We're in Dayton. A little bit about how you got this campus. This is amazing.
So bottom line, we're at the house that Sesame Street built, right? And I'll get to that. But, going back to, well, let's talk about that for just a second. So this beautiful campus, this 36-acre, $4 million, and then in 2019, it was a $4 million estate, was gifted to the Magnus Veterans Foundation by my aunt and my uncle, Sue Rawlings and Vincent Egan. Vince created Sesame Street Live. That was created right here in Minnesota. And basically, Sesame Street built this property. And he was very successful with his business, had shows touring across the world. Interesting story. And I'm not sure if you'll use this in the final cut, but so the first 2 years, I was deployed to the Southern Philippines. So the 9/11 hijackers came through the Malaysian, Indonesian, Filipino pipeline to get here. So that was one of the first places that Special Forces went. And he happened to have a show up in Manila. So the Southern Philippines, very different than Manila.
Yeah, okay.
And I was able to basically leave a combat zone, fly into Manila, go see my Sesame Street Live, and then go back to the combat zone. So interesting story there. But yeah, so that Sesame Street built this property. My uncle passed in 2016. He was a veteran of the Minnesota Air National Guard during the Vietnam era. And my aunt basically made the decision to donate this property to this new concept of the Magnus Veterans Foundation, because I knew I wanted to do something related to what we were doing in 5th Special Forces Group for the veteran community. And I just, at that time, it didn't really understand, or didn't know which direction I was going to be until I came here in the summer of 2018, and I was taking care of my aunt. She was very ill. At that point, she had lung cancer, and I took 2 weeks of leave to be able to take care of her. And at that point, my wife and I and our young son were going to retire in Seattle area because we were stationed in Fort Lewis, and we loved that area. And then our son started asking for a sibling. And like I told you before, I'm 55 with a 16-year-old, and I'm originally from Minnesota, and I have lots of brothers here, and he has lots of cousins. So my wife's like, well, maybe that would be the best place to go, so he has his cousins. And she asked me to pray about it while I was here taking care of my aunt and see if there was something useful that our family could do here in Minnesota. So I was out walking the road that goes down to the lake and up to the highway. It's about a 3/4 mile walk. And I was out there for 2 hours thinking about this and pondering and praying on it. And when I was coming back up, there's a crossroads down there where I got sick. And at that point, I was in much better shape than I am now. But when I stood up, it was like something hit me in the back of the head. And I immediately recognized what this place could be. At that point, I had been doing this Preservation of the Force and Family initiative for about 2 years. And I thought to myself, this has always been the most healing and serene space in my life. We can do exactly what we're doing with 5th Special Forces Group right here. And so I called up my wife. I told her our idea. She started crying. She said, go talk to your aunt. I came up and I sat on her bed. And I told her, and then that's when she started crying and made the decision to donate this estate to this new concept of the Magnus Veterans Foundation. And it's interesting because we have naming rights, by the way, if anybody wants a building or a road named after them. But we only have one road that's been named now, and then that's that road that goes from the lake up to the highway that I walked, and that is called Epiphany Way. So that will never be changed. That will always be Epiphany Way.
It's quite the story, and hearing about the work you do here. The topic we're looking at today is trying to dive in a little bit more on veteran suicide. And it's something that I've been professionally working, in the veterans community for veterans for last 12, 13 years now. And it kind of gets touched on, but it gets touched on in these really awkward ways that I can't stand, right? It's awareness. It's the 22 push-ups. It's right. These ineffective, well-meaning people who engage in it. I understand. Ultimately, I think they feel powerless to impact this. And so, but I really wanted to take some time, talk more about, what you're seeing in the veteran suicide, the mental health crisis, and ways that can be addressed here and, back in communities. So I guess a little bit about how you're maybe addressing it here, and then we'll work our way out from there.
Right. Yeah. So, I showed you earlier our waiting room, our grand waiting room, right? It's not unlike any other waiting room at any other medical facility you'll see. And it's designed that way because we want that to be open and inviting. So our veterans show up even when they don't have an appointment, and they hang together, they check on one another, they lift one another up. And that ultimately is the key ingredient in ensuring and addressing the veteran suicide rate. We have to have veterans checking in on other veterans. We have to have veteran families and communities checking in on veterans. That's the most important thing. And I agree with you. There's a lot of talk about, awareness and all that, but no action. Until we get to a point where it's acceptable and there's means for us to check on one another, that's the most important thing.
Yeah. Community. So earlier in this episode, we have a conversation with the VA suicide outreach team, and that goes out and trains veterans and community members to help try to intervene and find ways. And one of the things that keeps coming back is community, right? It's that connection to other veterans. It's that connection to other people that really seems like it might be kind of the secret to starting to address this epidemic of suicide.
Yeah, I absolutely agree. Activating that community, giving them the understanding of how to approach somebody who might be in crisis, and being bold enough to ask those hard questions. Like, are you okay? And we're really fighting a battle of veteran isolationism these days because nowadays less than 1% serve, right? And oftentimes they'll go back to communities where, there might not be a lot of other veterans there. And with that, there's the potential for them to isolate further and further. And then that's when bad things can happen. So it's important that we activate veterans, veteran families, and our communities to be engaging of these folks, to draw them back into, mainstream society so that we can keep an eye on them. And we see that every day here at Magnus. I mean, over the past year or so, we've seen an uptick in the level of acuity and crisis of veterans showing up on our doorstep. And their stories tend to be, they're very similar. A lot of them are going to the VA health system right now, and they're saying, I'm ready for help. And the VA is like, we got you. but then they're being told it's going to be 3, maybe 4 or 5 months until they can get them in. And the veterans like, well, that's just not going to work. And I've heard this story from many of them recently. What they'll get from either the person on the phone or behind the desk is, well, have you heard about this place called Magnus?
Yep.
And they'll show up on our doorstep, and we've had some that have been acutely suicidal that have showed up. They haven't gone through the onboarding process. They're not a member, but our team here, we triage everybody that shows up, jumps into action. And, we get these folks the help they need. And it's not just us. We're partnered with other groups, including the DAV and other great nonprofits out there that are doing good things to help veterans. And we get them the help that we need.
Yeah. And we talk a lot about the point of crisis, right? And one of the discussions, separation from lethal means, things like that. But the point of crisis and identifying it, in your experience, is there things that people out there should be looking for on the practical side? Loved ones, fellow veterans, things like that kind of start to give us an indicator we're getting closer to that point of crisis.
Yeah, and it goes back to that isolation aspect of things. So if you start noticing withdrawal, that's probably the most important thing. And during that withdrawal process, there comes a point in time where they do reach out for care, and veterans are notorious for this, right? We kick the can down the road. Well, eventually that can goes over a cliff, and we're faced with two choices. We follow the can over the cliff, or we get help.
Yeah.
So we need to be always aware, when are they standing on that cliff, and how do we jerk them back from the edge of that precipice? And, I think we need to make sure that we all become experts in understanding and meeting veterans at that point in time, regardless of what health system you're involved with. We need to understand that when that veteran shows up at that point, that is a red flag.
Yeah.
And we need to set up the Red Star clusters. We need to, fire up the troops, and we need to get them the help they need at that point. And I think that's probably the most important thing, recognizing that there's going to be that period of withdrawal. There will be a time or two where they will, shoot up that star cluster asking for help. We got to be able to recognize that and wrap our arms around that person.
Yeah, I think, as we look at some of the more, the VA model, extremely disappointing that is not treated as an emergency situation at that point, right? They've made the step. They're making the phone call,
right?
Which is what we're constantly asking our fellow veterans to do, right? It takes strength to reach out, do that. And then to have a system in place that drops the ball, that doesn't treat it as the emergency that it is tragic.
Yeah, I personally believe that the VA health system should be the premier expert on meeting veterans from a mental health perspective in that space and time.
Yeah.
They should be the experts at that. And I'm not bad mouthing. I get my care through the VA. The VA does incredible things. The vast majority of our members here are patients within the VA health system. And I tell them, hey, keep your doc there, because I'm a family medicine doc. I'll never be able to replace your hip.
Yeah.
Right. But we augment what the VA does. We provide supplemental care, and then we augment that mental health care. And that's without any funding. All of our funding, our services are 100% free to our veterans and their families. And it's all from community and local business donations.
Yeah.
So, but if I were to give any advice to the VA leadership, it would be, how do you become the premier expert in meeting that veteran in that point in time, and not having them wait 3, 5, 6 months before, because unfortunately the chances are they may not make it to that appointment.
It's missing that window, missing that opportunity. We talk about in battlefield, they go, this is the golden hour, right?
Mm-hmm.
You've got this certain amount of time to extend life and to get to the next level of care.
Right.
And to not treat that mental health crisis like that seems like a real missed opportunity, a real missed kind of thing that we should be doing.
Absolutely. And going back to your comment about, activating our communities too, that that should be an important, very important part of them being the experts in meeting veterans in that space and time. Because we have to remember, before the VA health system, who took care of veterans?
Yeah.
It was our communities, it was our tribes, it was our families, right? They're the ones that took care of them. And if we can somehow figure out how we bring some of that old and mixing in with the new, I think that's where that sweet spot's going to be of being able to identify patients at risk and getting them the treatment that they need.
And as we look, at risk, and something that I take a deep dive every year when the VA eventually releases its in-depth study of veteran suicide, and some of the things that jump out are some of the indicators that we can see coming, right?
Mm-hmm.
I think 168% more likely to veteran suicide if you're experiencing homelessness, even more likely if you're a veteran and justice involved. Poverty is the number one indicator we have.
Mm-hmm.
For the veterans that commit suicide that are getting care in the VA, they are getting care through the needs-based eligibility priority group, not through the service-connected.
Right.
So there are some of these things. And as I think about your total care model here, what are some of the things that you can do that, we talked about it before this, about the whole health, about the veteran and things like that. So on the practical side, what are those things that you can implement here?
Yeah, I think first and foremost is recognizing that there are those indicators, right? And realizing that we're not going to be able to address all those. So we developed our networks. We've got our great partners. So when you talk about homelessness, we're partners with MacV and Haven for Heroes, right? We refer to them, they refer to us. So there's that mutual support where we're addressing not just the homelessness, but then also the mental and physical, health issues. To poverty, there's other wonderful, nonprofits within Minnesota, Project Got Your Back, Home with the Hard Hats, and several others, and we partner with them. So when we identify that somebody that has that need, we refer to them. And then when they identify someone who has that medical, physical, spiritual, social, psychological need, they refer to us. And then we basically co-manage these patients. And then going back to the practice approach, right? It's important to recognize that us as human beings are more than just physical.
Yeah.
We're more than just psychological. We're more than just spiritual or just social. Because routinely in our traditional health systems, those things are addressed in sort of a stovepipe manner, right? You go see the physical doctor for your physical stuff, and then you go see the mental health doctor for the mental health stuff. And if you've got some social needs, you go to that person. And a lot of times there's no talk between the two. So you've got all these different silos operating. Well, here we have a coordinated, comprehensive model where we have all those subject matter experts. We all work together to take care of that patient. And then we meet routinely, at least once a month, where we'll sit down and all those experts, physical, spiritual, social, psychological, and medical, we'll sit down and we'll break open patient XYZ's chart. Okay, where is Sam or Sally? Okay, what are their goals? And that's the important thing, right? So at our heart, we are a performance-based company. Every patient who signs up here signs an oath that they are committed to being the best version of themselves physically, spiritually, socially, and psychologically. And they identify what their goal is. We don't, right? I mean, it's probably the easiest to understand from a physical realm's perspective. You might have that World War II vet who just wants to be able to climb up the stairs to be able to sleep in the same bed as his wife, and because he hasn't been able to do that for years.
Yeah.
And then you might have that young vet, and she wants to run her first ultra marathon, right? And everything in between. So they identify those goals, and then we use those goals as a group, as a collective group to figure out where they are in that process, and we make recommendations based on that.
Yeah. As you're taking this kind of this, and you touched on it, the siloing. Siloing is just awful. I see it, working closely with the VA and different things, and they don't know. The mental health program doesn't know what the homeless vets program is. They don't, and so they can't seem to connect in that way. But to do that, you first have to get the veteran in the door, right? And
Mm-hmm.
what are you seeing as kind of the barrier for that initial in the door, coming and saying, I want to be a better me, or I need help, or whatever might drive that motivation to come out here the first time?
Yeah, I would say the risk factors for barriers to coming in that door would be, first, they're a veteran, right? They're stubborn, they're skeptical, And then the male veterans, for sure, they tend to be late adopters. Our female veterans were early adopters of our program, and we're super excited about our women's health programs here at Magnus. But it's recognizing those two things, and then our outreach, we've tried multiple different things, right? Social media, different marketing firms, that kind of stuff. But ultimately what it comes down to is word of mouth, right?
Yeah, veteran to veteran.
Veteran has to hear from another one because, a lot of these guys who show up here, you'll say, I heard about this, but I didn't believe the fact that someone donated a $4 million estate to be able to take care of me and my family. Come on, who does that craziness? And, when you come through that door and you're that skeptical, I've told you earlier, we've had big, burly veteran biker dudes just break down crying right there, right when they realize that this is real. These are these people here we are here to take care of them. And then the other thing is they're either being drug in by a spouse or a fellow veteran, and really it goes to kind of that same approach we saw back in 5th Special Forces Group with me knowing the command sergeants major.
Yeah.
Their wife typically will come in and realize the incredible things we're able to do here, and then she'll drag him in, or vice versa.
Yeah.
Or you've got a veteran who comes here and his fellow veteran friends see the difference that it's made in him or her, and then they come and join. So we're onboarding, so we're at about 1,100 patients right now. We call them members, right?
Yep.
Because it's way more than just a patient experience. You get access to all the good stuff we have here, plus our entire estate. Our members are the only ones allowed to use it. We are not open to the public. And where was I going with that? See, I get to talking.
You get excited about what's going on
I
here.
get fired up in multiple different directions.
It was the overcoming the barriers, right?
Yeah.
And once they experience it, it sounds like the best ambassador is a veteran who's used the services and goes back out and drags their fellow veterans in.
Yep, and we see that all the time these days.
Yeah.
And we're onboarding 5 to 10 new patients a day, right? So I told you earlier we're in the midst of a capital campaign plan because we have to build out that other building because we have to expand our clinic now.
Yeah.
And we always knew this was going to be part of the process because our ultimate goal is to grow to 5,000 patients, 5,000 veteran families. And we're at 1,100 now. So we are actively looking to expand so that we can continue the good work for even more veterans. And then our ultimate vision is that we continue to demonstrate that this is how you take care of veterans as the whole person, as the whole family. And then we take this across the state, and then we take this across the country. And, I'd love to have a seat at that table as we discuss the future of veteran healthcare. Because I think we have a lot to show here. We're able to deliver all these services for just $50 per person per month or $600 a year. So,
and the evolving model makes sense. And something that I've thought about several times as we've been discussing this is the generational shift will require a new model, right?
Mm-hmm.
And we were talking about, this was introduced in Special Forces, which makes sense, 12, 14, 15 deployments. To combat zones was something that previous generations, that was specially to Special Forces, right? Specifically.
Right. Yeah.
And there was a decision made post 9/11 to use less troops more times.
Right.
And so now your infantryman was 5-6 times deployed to Iraq and Afghanistan, where it used to be a very small isolated group. Instead, we used less troops more times. And so it's not uncommon for somebody who did, 6 years, 8 years to have 3-4 combat deployments.
Right.
And so finding a way to expand a model that adapts to that unique situation. Less veterans used more.
Right. And I think the important thing to realize too, and in that person who served for 8 years and said they did 3 deployments, they were not triggered on, right? Their sympathetic nervous system wasn't firing just while they were deployed.
Yeah.
Right. Because when they came home, they couldn't turn it completely off. And a lot of people say, well, you were at home, you weren't deployed. Yeah, but they can't. They're not really fully engaged in juniors baseball game. They can't turn it completely off because they realize that they're going to go back. And that's unique to today's warfighter or veteran, is because we have to recognize that there's those periods of trauma while deployed, but there's also those subacute exposures in between those deployments.
I don't, I wish I could remember. It was a long time. My first deployment was 22 months, and I was in Iraq for 16. And that entire time, I had my weapon on me, right? Where we were was a small base. You always had your weapon, you always had your ammo. And I bet it was a couple of years before I mean, I'm getting up from a restaurant, leaning over to grab my M4, you know, it had become such a thing, you know, if I let my mind slip, all of a sudden I'm reaching for my M4 at Perkins, you know.
Right. Yeah, absolutely. And certainly, you know, with Iraq and Afghanistan, you know, I think even to this day, if any of us see any rubbish on the side of the road, right?
Yeah, there's a little
in the back
factor.
of your mind is, you know, like, well, okay, let's steer clear of that one.
Yeah. You know, you let your mind wander, and I laughed it off. I came back, and they're like, "Well, don't drive right away. You know, let the family member or somebody drive." And I was like, "Okay, yeah, all right, doc." And then I get in the car, and I of course drive myself, you know, back from the returning home thing. And sure enough, they were right. It's like, oh, you know what? Actually, I'm not ready to drive. I pulled over into a cornfield. I was like, hey, can you take this car? Like,
yeah, when I returned multiple times, I would drive very aggressively, very offensively. So I was usually kicked out of the driver's seat by my wife.
Yeah. So we get past the barrier. We get the veteran in the door. And I know there are a lot of different ways to treat, you know, post-traumatic stress and those types of things, you know, depression. Are you seeing models that work, you know, more often or non-traditional? You know, there's the talk therapy. I know when I went to the VA, my first time 15 years ago, they gave me a bag of pills, and that was the model they were using. Met one doctor for 10 minutes. I left with 6 prescriptions and a good luck. And so are you seeing a model that is developing here? Are you developing new models?
Yeah, certainly not the here, take a bunch of pills model. That does not work, primarily because there wasn't that rapport development phase, right? I mean, there's that old saying that people don't care about what you know until they know that you care. And so it's important that we fully understand that whole person, physically, spiritually, socially, and psychologically, you know, employment, family dynamics, and all that stuff, and then make treatment plans with all those inputs in mind. And then also realizing there's not just one, there's never a magic pill. There's never a magic bullet that cures things, in my experience. And it's recognizing that you need a multidisciplinary approach. And we're able to do this with our psychologists and our licensed independent care social workers. They'll do the talk therapy. They do EMDR and ART. These are 2 different modalities, which a plug out there to the HUA Foundation of Minnesota. They paid to have our therapists trained in ART, which is a abbreviated version of EMDR for the treatment of PTSD. And so that was incredible, and it's doing great things for our veterans. But then also, you know, talking, you know, having that multidisciplinary discussion afterwards to see, you know, hey, is this person a candidate for some medication? You know, a lot of times people come in and they won't want medications.
Yeah.
And so our therapist will get them to a certain level, and then they'll realize that, hey, maybe medicines might work. And now that therapist is doing a warm handoff to me, and then I'm sitting down with them. We'll spend an hour. And that's one of the reasons I love this practice. I'm not beholden, because we're not billing any insurance companies at all. I'm not beholden to, you know, time limits. If I want to spend an hour with a patient, I can. Yeah. And so I'm able to sit down and talk to them about the risks and the pros and cons of different medications. And then we make a decision together. And I tell all my patients, you know, we're partners, and you're never going to hurt my feelings if you think that I'm wrong or you don't like what I have to say. We just need to talk it out. Yeah.
Excellent. I think we're going to take a little bit of a break here. We'll come back. We'll wrap up this discussion, and hear a little bit more about Magnus Foundation here in Dayton, Minnesota. Welcome back to Veterans of the North. I am Trent Dilks with the DAV of Minnesota, and right now we have Chris LaMotte joining us. Chris is involved here with the Magnus Veterans Foundation. First as somebody who used the services, and now that's somebody that's helping other veterans. Chris, welcome to the show.
Thanks, Trent.
Well, let's start out right at the beginning. What leads you to the point of coming to Magnus Foundation for the first time?
What led me to coming to
Yeah, your
Magnus?
service and
Yeah.
kind of, what road brings you here?
It's kind of a long road. I mean, I feel like when I came here, I was ready to give up.
Yeah.
And I really thought that maybe this was my last chance, because I was drinking myself to death, and I was absolutely suicidal.
Yeah.
And I was dangerous to be around, and I knew that.
Desert Storm veteran, right?
Yes, sir.
We were talking a little bit about that initial kind of coming home experience. You want to share a little bit about that with us?
Sure. So I joined the Minnesota National Guard out of high school. Went right to training. My first summer off there down to Fort McClellan, Alabama. Got through basic and AIT, and then it wasn't long after that we had desert. We had the buildup over there where Iraq invaded Kuwait, and I was with the 47th MP Company at the time in St. Paul. They've since turned into the 34th. My unit wasn't going, but the 257th in Cottage Grove was going, the 257th MP Company. So I deployed with them. We did our desert warfare training at Fort McCoy, Wisconsin in the middle of winter.
One of the most desert places I've ever been. I experienced it on both of my deployments, and that's spot on. That's spot on for the Middle East.
Yep, right on.
That makes Army sense.
Went there and did things and seen things that you can really only experience during war. And that being said, I'm not saying I was in combat or anything like that. We guarded a lot of stuff. We took care of hundreds of thousands of prisoners, which was an interesting part of our mission. The Scud missile attacks were kind of crazy. A lot of the things happened. Iraq, parts of Iraq and Kuwait were totally on fire. All the oil wells were burning, and we were covered in that stuff for months, it seemed like.
Yeah.
But I came home and I can tell you, we came home on Memorial Day, and the plane touching down in Wisconsin, that's where we landed in. They opened the door on that plane, and I could smell cut grass on the edges of the tarmac.
Yep.
And it just made me cry a little bit. Like it smelled like home.
Yeah.
And that was a big deal for a Minnesota farm boy,
It's hard to describe that feeling. I came back from my first tour, and I'd been 14 months outside the United States in Iraq. And it's hard to describe that door opening. I also landed at the airfield there in Wisconsin. And just that shock. It's overwhelming. It's numbing, right? It becomes a blur. I remember somebody took my weapon for the first time, right? I had this thing for 22 months. This had been my thing. And with no ceremony, and I didn't even get to give it a kiss goodbye, somebody took it off, and they took care of cleaning it.
Back to the armory.
And it was gone, And so, it's a shocking moment. It's a shock to the system. It really is. It's, I don't know. It's hard to describe. I think both our listeners are veterans, so they kind of get what we're talking about. But it's difficult to describe that moment.
Yeah. We actually came home on Memorial Day, and they gave us a couple days to spend with our family. Okay. And then we actually went back and did our out processing. Oh. So that was really a gift, I think, for us. But I kind of had my first sign that things had changed for me, and I was sitting in my parents' living room, and it was the first Wednesday of the month, and we know that sirens go off at 1 p.m., and that siren went off, and I jumped out of that recliner chair looking for my gear. Yeah. I instantly just pegged right to the top,
0 to 100. Yeah.
Yep. I felt like in those years after getting out, I lived like my hair was on fire. Yeah. I couldn't ride a motorcycle fast enough. If there was a risk to take, if there was a bar fight to be had, and there was no bottle of whiskey that I couldn't find the bottom of. Yeah.
Yeah.
I knew I was having some issues, and I went to the VA, and I really kind of had an awful experience there. And I'm like, I am never coming back here again.
Yeah.
Um,
I think that's something you get one shot, right? And I know my first experience, I wasn't back for years. It was not a thing, and I've gotten good care at the VA after, but that initial place that I went and the initial people I saw, and that was it. That was, they had their one shot, and then for years I wouldn't go back. And I think that's going to be important because I want to circle back to that when Magnus gets its one shot with you, right?
yeah.
And
For sure.
the road that leads there. So you've had your years of struggle. Something's wrong. The one place that's supposed to be able to help you is not somewhere you can go. At some point, you're led to the doors here, right? Is that?
Yeah, so it's a long journey too. But despite all my self-destructive behavior, I met my wife. She's currently my wife still to this day. I'm blessed for that. We've been married for 25 years.
Congratulations.
She's a pretty tough woman who's been through a lot with me. But I can tell you that she gets me to calm down a little bit. I actually quit drinking. I go to I do some AA. I do some recovery stuff. I get sobered up, and now we're full blown raising family. Kids are on the way, and like any young family, I'm working. I'm doing brick and stone work. Doing building restoration. I'm doing side jobs. Doing some alley chasing, doing chimneys, and I'm also doing a lot of work in the bars on the weekend. I'm working as security, being a bouncer. Did it for a long time, and through that, I had an experience in 2010. So I was working at a bar in Minneapolis, and there was a man there. He was so drunk he couldn't stand, and I wouldn't let him in the bar. And I offered to buy him a ride home. We'll get you a cab home because obviously he was super impaired, and he didn't take anything I had to say to him too kindly. He drove home and he smoked a bunch of meth, and he came back at 1 o'clock in the morning and he attacked me with his mama's biggest kitchen knife.
Okay.
And when I couldn't disarm him, I was forced into a spot where I shot him and killed him. And he died on the sidewalk that night. And all that stuff that I had going on from my deployment that I had managed to stuff in a bag, because that's really what I did.
Yeah.
I stuffed it in a bag, and it was buried deep, right?
Yeah.
All that came back, and it came back harder than ever.
Yeah.
And I just really, that was a struggle. I had about 7 years of sobriety through that time. And I started drinking. It was within 2 years I started drinking again. Some of the things that happened with that was this man that I had the altercation with, he had a lot of people, like his buddies and stuff were actively looking for me, and they had a Facebook page about him saying, well, how would I feel if I lost my kids? And, they were not only threatening me, but my kids and my family. It actually forced us to move. It put me in a spot where I was hyper vigilant all the time. I mean, like, now I'm ready for a gunfight.
Yeah.
And that wears on a guy.
Yeah.
Life really got messy for me after that. It was just tough on us. I didn't know if I was going to prison. I didn't, all the things that you deal with. Do I have to divorce my wife for legal reasons to protect my family? Honestly, I can tell you that Minneapolis PD and all those things, I was really treated well through all of that experience. But to move forward a little bit from there, I feel like the family's unstable. I'm obviously unstable, and I'm medicating really the only way I know how. And my 14-year-old daughter and her best friend get hit by a car crossing the crosswalk in St. Francis from the McDonald's to the middle school in St. Francis on Highway 47.
Okay.
They got hit by a car going about 50 miles an hour. And our girls are just broken. My daughter Annie and her friend Kaya. And Kaya actually, she quit breathing on the road and was actually resuscitated by a nurse who was passing by.
Yeah.
We are forever thankful for that angel. My daughter Annie and Kaya, they broken pelvises, like crushed pelvises, broken femurs, traumatic brain injuries, road rash, and you know, so that was another huge piece of trauma that our family really, I would say, suffered through.
Yeah, absolutely.
There's a lot of growth when those things happen too.
Yeah.
But it's pretty tough.
Yeah.
I would say COVID was, you know, and COVID was hard on everybody. But I would say my drinking got worse through that.
Yeah.
And I can say directly, my drinking was out of control, and some of my drug use as well. But those are the tools that I had to deal with what I was dealing with. I didn't know that there was another way.
And this is treating the mental health crisis that's developing and it's been prolonged, right? That's
absolutely.
This is the self-medication. This is the numbing agent to try to cover up that mental health crisis that you're going through.
It really is. I don't want to say it's easy for me to talk about this, but I talk about it because I know. So I have a couple things, right? I have how it was, I have what happened, and I have how it is now.
Yeah.
And I'm hoping that by sharing that, I can affect other veterans, and honestly, not even veterans, even just people that have dealt with trauma in their life, because there's a better way.
And I think, and I really appreciate you sharing this. This is tough stuff, but as a veteran community, we have to be able to have these conversations because there are other veterans out there going through it. There are other veterans trapped in this cycle that have been for a long time.
I agree.
And to know that it's okay, to know that there's a light at the end of the tunnel, and to know that ultimately the hard step of reaching out for help is going to be your way through it, right? And so I really appreciate you sharing this, and you know, we're getting to that point now into the story where you're, I imagine, about to have to take the hardest step, and that's the way out, right?
Well, there's a few more things really happened, and a good friend of mine, I'll say his name was Brian Reichert. We didn't serve together. He was a GWAT veteran, but I knew him from sitting on a bar stool at the local Legion, and him and I got to be pretty good buddies, and even though we didn't serve together, we felt like we were kind of battle buddies. Maybe we were bar stool battle buddies, right?
Yeah.
So him and his wife, Cassie, and myself and my wife, you know, we did a lot. We would cook together. We would hang out together, do all these things. Well, Brian drank himself to death, and that was a hard thing. I not only lost a friend, but it also put a light on my drinking and how I was living life. And then 6 months after that, I had a friend of mine I grew up with, and he was also an Army veteran, and he called me up, and he was headed to the woods to kill himself, going up to the deer camp. And he called me. It was like 11:30 at night, and I actually hung up on him because it hit too close to home. I didn't want to talk to him because my depression and all these other things were just too great.
Yeah.
And honestly, I broke down in that moment. I'm laying in bed. I broke down in that moment. I called him back, and we ended up talking for a couple hours. And he says to me, well, we talk, and he says to me, so after sharing, he's sharing to me, and I'm sharing to him. And he says, dude, you should go to Magnus. And I'm like, you called me in crisis.
Yeah.
You know what I mean? But honestly, I took him up on that. And after my VA experience and all those things, I'm like, you know, well, I didn't know what to expect, right?
Yeah.
But I thought I'd give it a try, and it really felt like it was my last chance. I knew I was going to die if I didn't do something. So I came here, and I met with Christy, the medical director, and I kind of told her my story and what was going on, and then she scheduled for me to meet with Dr. Alderman and talk to him, and I got some auricular acupuncture, you know. That's kind of where it started.
Yeah.
And started going to some recovery meetings around here. And honestly, I just started doing everything Magnus had to offer.
Yeah.
And it just got me on the out of my stuff and on the right track.
You kind of plug into that holistic care model, right?
Absolutely.
And we heard a little bit about it earlier in the episode about, the whole service. I think the cup here, right?
Right.
Is this an example
my
of
mug,
the whole veteran?
This is a piece of it, right? So this
Yeah.
is something we did in one of our pottery workshops. So, yeah, I've got. So I was volunteering. I was doing brick and stone work, and I was able to take an early retirement from the union, and I went back to work for another season and working in Milwaukee. And Doc said, "Hey, I think I have a job for you." So I went from bricklaying to working here. It's been a huge change for me.
Yeah.
But it's really been good.
And you touched on something during that. You're talking to your friend who's in crisis.
Mm-hmm.
And the veteran, your friend in crisis is telling you that you should get help, and you're telling him he should. And
That's the veteran way.
but isn't that the veteran way? Isn't that
Yeah.
the way? We won't stop to help ourselves, but our battle buddy calls up, and it's like, wow, man, you got to reach out for help, and you got to find this way to do it. And I don't know, it's very interesting. And now you've kind of found your calling here, right? In the work you're doing and helping your fellow veterans.
Yeah, I'm so fortunate I get to work here because the place saved my life. It changed the trajectory of my life, and with that, my family as well.
Yeah.
So yeah, that's been great. I would say prior to coming here, I was starting to do things like the ruck marches with 23rd Veteran and doing the push-up challenges like Doc talked about, and doing other things like that because I was trying to straighten myself out, and I've kind of felt like, well, maybe by serving others, I'm serving myself. I do believe that's true.
Yeah.
But I really wasn't getting to the heart of what my issues were.
Yeah.
And I remember going on like 23rd Veteran Ruck March going, I'll never get to be a part of this. And actually I did a recon with them this year. And I would say that's because of my time here and getting to connect with veterans on different levels.
It really is.
It's made me a proud veteran again.
Yeah. It's that sense of community. And when that's lost, I think that's really... if we can find that point, we're going to find the road that leads to crisis. As somebody who's gone through it, one of the questions I like to ask veterans who share their stories here is, there are other veterans out there that are experiencing similar things, that are going through it, that are somewhere in that journey. What advice would you give to them? What words of wisdom, what advice, would you tell them if one of them's listening right now? What would you share with them?
I think I would tell them to dig deep and find the courage to reach out and ask for help. And there's so many different services out there for veterans. The hardest thing for us is to step up and do it ourselves and take care of ourselves. We'll always defer to helping the other guy, or I don't want to take up this spot for someone who needs it more than me. You know what, brother, you need it. And when you get it, you can start helping other veterans.
Yeah. The discounting of our own service, the discounting of the need is something that absolutely needs to be addressed. Well, Chris, I really appreciate you coming on. I appreciate you sharing your story.
Yeah.
It takes strength to ask for help. It takes strength to share your story, and I appreciate you being here on Veterans of the North.
Thanks, man. I appreciate it too.
Men who fight by night and day, courage take from the Green Beret.
Welcome back to Veterans of the North. I'm here once again with Dr. Alderman. Dr. Alderman, we just heard a personal impact story that was really touching. I do want to kind of expand a little bit. You shared one with me kind of offline here. The Magnus Foundation isn't just for veterans, right? It expands out to the family and the eligibility for your members. Do you have a story that you can share that maybe really expands that impact, how this place and how this model cannot just only, not only help the veteran, but expand out and help the family.
Yeah, absolutely. I think first and foremost, we recognize that it's not just our veterans who served, right? Because when we enlist, you don't just enlist yourself, you enlist the entire family.
Yeah.
They go through you with all that. And, I told you before, my first combat deployment was Mogadishu in 93, and my last was a fight against ISIS in Syria in 2017, and I've got a 16-year-old son. And my wife and my mother, they bore the brunt of all those deployments as well. So I knew it was going to be incredibly important to us to take care of our veteran families as well. And these kids that grew up during that time frame, we're not going to know the real impact on those kids for 30, 40 years from now, So it's very important that we take care of families, and that's important to the individual veterans' health as well. And I'll use one case to highlight that. We have a veteran who injured his leg overseas, and probably should have been amputated at that time, but he wanted to try to hold on to it. So he came back to the States, and a year or so passes, and he's trying. He's having multiple surgeries. It keeps getting reinfected, and then ultimately makes the call to have it amputated.
Yeah.
So he has it amputated, and then he comes to us a little bit after that, and we're working with him. And again, we talked about how our patients, they define their performance goals. Well, he defined his, and we weren't able to get to that next level with him. Well, come to find out, his young son was really struggling with the fact that one day dad had a leg, and then one day he didn't.
Yeah.
And having my son and understanding, the anxiety that these kids bear, related to whether it's trauma of war or trauma of witnessing something like that, we knew that we had to take care of that kiddo as well to get his dad to that next level. And that's why all of our therapists here take care of the entire age spectrum.
Yeah.
So we got that his son in, and they're doing incredible now. And it's really accelerated his projection towards his health goals.
And if you have a model that couldn't do that was restrictive, that said, my funding source only allows me to treat the veteran or things like that, it would be impossible to hit that next level of performance measure, right?
Absolutely. And that is the VA health system now, right? They take care of just the veterans. And, if somehow, even with those restrictions, if they can somehow figure out, well, okay, what is that family dynamic? What are the needs of that family? And incorporate that into the treatment plan for that individual, at the very least, would be helpful.
I mean, to not be able to look at the things that are surrounding the veteran, hard to treat the whole veteran if you can't treat the whole veteran.
Because all of us know you're your dad as well.
Yeah.
Just had your last baby, right?
Yeah.
We all know that if our kid's suffering, there's no way we're gonna be at 100%. Of our performance goals. So it's always important that we look at the whole person, the whole family. And then once we've got that, then we look at the whole community.
Yeah.
So, and being a family medicine doc, it resonates with me. It makes sense to me. So,
excellent. Well, I appreciate you sharing about the Magnus Foundation. For our listeners, how can they learn more? How can they get involved? How can they help?
Yeah, absolutely. So if you go to our website, which is magnusveteransfoundation.org, there's 3 buttons up in the top right. It tells you everything you need to know to get involved. First, join.
Yeah.
Right? If you're a veteran or you're a veteran family member, we're free to you, 100% free. Come see what we've got. We give tours the first Tuesday of every month, starting at 11 a.m. So if you can come check us out and then join us, and we'll help you get to that level of performance that you want to be at. And then the next would be volunteer. We've got over 100 regular volunteers. We got a 36-acre beautiful estate campus, and it takes a lot of work. So, if anybody's interested in volunteering, or if we have kids looking to pad their college applications, this is a great opportunity to do that. And then it's important to recognize that we exist because of donations.
Yeah.
Right? The vast majority of our funds come from individual and corporate donations. And the most popular one of those is our sponsor, a vet line. So if you donate $50 per month or $600 a year, that 100% goes to take care of that veteran for that time being. So all those folks that are required to use those end of year minimal distributions, excellent opportunity to take $600 of that and sponsor a veteran for an entire year. Again, 100% of that goes. No administrative costs come out of that money.
Yeah, and from my perspective and over a decade in this space, I would just, hearing about your model, I've been hearing about Magnus for years now, and being able to see this campus and hear more about what you do, I hope more veterans will reach out. Again, what was the website?
It is MagnusVeteransFoundation.org.
MagnusVeteransFoundation.org. Check it out. I think you really have a lot to offer, and I hope to see you grow this model and impact more veterans. So thank you again for being on today.
Hey, thank you, Trent. Appreciate everything. Thank you for your service, brother.
Thank you.